to attend this webinar about vision and attention. Excuse me, my name is Dr. Valerie Fraser. I am board certified in the area of vision therapy, vision development, and neurooptometric rehabilitation. I'm the owner of the practice New Horizons Vision Therapy Center. So today, if you haven't done already, I should say you can join the audio by logging in with a telephone or through the mic and speakers. Today we're going to talk about attention deficit and things that can happen with the visual system that can interfere with attention. It's not by accident that we talk about focusing our eyes and focusing our mind. We use that same word. Vision has a lot to do with being able to attend, and visual attention can be compromised due to certain visual problems that we'll discuss today. The first thing I'm going to talk about is the academic behavior survey. This survey was done to help diagnose kids with attention deficit disorder and some of the school, it's called academic behavior survey because a lot of times this is picked up more in school. Your child is having issues paying attention in school, they're not getting their work done. So this was a survey to kind of find out more about those to help with the diagnosis. So the questions on the academic behavior survey include how often does your child have difficulty completing assignments at school? So each of these questions, I should say, parents assign a score between 0 and 5, 0 being never and 5 being frequent. How often do you have difficulty completing homework? How often do they avoid or say they don't want to do tasks that require reading or close work? How often do they fail to give attention to details or make careless mistakes in school or homework? And how often do they appear inattentive or easily distracted during reading or close work? And finally, how often do you worry about your child's school performance? So these questions were a part of, like I said, the survey for diagnosing attention deficit, but later were used in a visual study that we're going to talk about that relates to some of the visual skills that oftentimes we see kids have difficulty with that will affect all of these areas. So we're going to start, though, to talk about vision, we should talk about what it means to have good vision. So typically when we think about vision, a lot of people will say, well, what is good vision? And the word 20/20 comes up. So it's good to understand what that is and what it isn't. So 20/20 refers primarily to a distance measurement, although it has been converted to near. It's the first number on the chart represents the distance you are away from the chart, so it's calibrated for 20 feet. And then the second number relates to the size of the letter. So the big letter at the top, the big E, is 2200 usually, sometimes 2400, and then you go down, things get smaller, so this red line down here designates the 20/20 line. So you can see those letters are a lot smaller, and most people can see that size letter at 20 feet. If you have a shorter distance, you just recalibrate the size of the letter to correspond to that. So let's talk about so that's what 20/20 vision means, but let's talk about what it doesn't mean. So it doesn't mean that you don't need glasses. If you can see 20/20, doesn't mean that you can do that efficiently, doesn't mean that you can do that without struggle or strain. Doesn't even mean that you can see well up close, because it is a distance measurement. So many kids can compensate for their what we call refractive error or nearsighted, farsighted astigmatism and still achieve 20/20 visual acuity. The ones that have the hardest time compensating are usually those nearsighted people. Those are the ones that can't see far away. So it's opposite of what you often think. The other problem with this measurement is that, again, it's not a near point test. So a lot of school screenings only test distance vision. They don't test to see how kids are performing up close. And as you know, where does most of the learning come? Up close. So it might be important to kind of check that to see how, if that's being affected. There are a lot of even refractive errors, such as astigmatism and farsightedness, that won't affect distance but will affect near vision. The sad part is that even if you go to the eye doctor, a lot of eye doctors don't check up close. They don't check to see what's going on and how things are functioning. And some parents don't mention that, they're having trouble in school. So there's a lot of extra testing that you have to do when you've got someone with a learning problem or having trouble attending at near to rule out other types of visual problems. So now that we've established that 20/20 isn't necessarily the end-all be-all when it comes to good vision, let's talk about some other visual skills that can interfere with attention and learning. So those skills include eye teaming, eye focusing, eye tracking, and visual perception. And we're going to go through these areas, except for vision perception. I'm not going to get a lot into that today. That's probably a whole separate lecture of its own. So vision perception, the short answer to that is that about understanding, interpreting, and integrating what we see. So once you've got the information in, what do you do with it? How well you can remember it, how well you can discriminate similar-looking things. How well you understand sense of direction as it comes to letter reversals. Those things, too, can interfere with attention, but for today, we're just going to focus mostly on the teaming, focusing, and tracking. So let's talk about what I mean by eye teaming skills. So you have two eyes, and those two eyes point hopefully in the same place at the same time to give you one, depth perception, but two, a single and clear image. When we look closer at a book, our eyes have to what we call converge, or basically turn in towards each other in order to maintain that single vision. When they don't, then what can happen is that things can look a little double or get blurry, or they have more trouble just if it's work to kind of keep things clear and single, it'll be harder for that person. So when we think of eye teaming, some people think, well, I don't see an eye turn. Well, large eye turns are a problem, and they certainly will mean that you won't have very good depth perception. But oftentimes, large eye turns don't necessarily mean that you're not going to, having a large eye turn may or may not interfere with academic behaviors. The reason for that is that when you have a large eye turn, you've got one image. Oops, let me try that again. You've got one image with one eye, and it'll move over here. You have another image with the other eye, and if they're far enough apart, they're not going to overlap, and your brain might learn to ignore the other image. So if it's always the same eye that's turning, a lot of times someone will develop what we call a lazy eye or amblyopia, where that eye just is ignored, and eventually they don't see as well out of that eye. So that may or may not interfere with schoolwork. It certainly would mean a less efficient system, but sometimes, I can get some people who function pretty well even though they do it with one eye. They may not be as good at sports, but it may not interfere in the classroom as much as someone who has a small eye turn that you can't see, like what I often see in my office, is that these small eye, not even a turn, but just eye teaming coordination issues is more likely to create interfering double vision, unstable visual image. Sometimes the smaller the difficulty, the more interfering it can be. It can look like things crowd together. That often happens when the eyes are over-converging versus insufficiency, where convergence sufficiency, where they're under-converging. So this type of eye teaming problem, aside from being hard to look at, may also cause difficulty with fatigue. It sometimes just causes where the eyes have to work to try to focus. So oftentimes when you're confronted with working hard to get things to focus, A lot of kids, especially younger kids or kids that aren't as motivated for reading, will just give up before it actually even looks this way. They just know it's hard, it doesn't feel comfortable, I don't like looking at it, therefore I'm not going to do it. Or I'm going to get distracted very easily because it's hard, the page itself is hard to look at. But before our eyes even work together to kind of put the two images together, each eye has to focus on the words. So if we look at focusing skills, like I said, it's not by accident that we talk about focusing in a clarity sense and a focusing our mind sort of sense. The focusing system in each eye, or the medical term is accommodation, involves this lens that's kind of right behind the iris. And what happens is when you look far away, that lens is controlled by some muscles that tend to relax to look far away. When you look up close, it has to do some work to get things clear so that the lens moves so that it can focus things on the retina, which is back here. So in a young adult, or even in a young child, we expect that focusing system to be working the way that it should. It should be easy to switch focus from near to far. It should be easy to sustain focus for long periods of time. It's not until we get to about age 40 where we have trouble with the lens itself. Is not, it hardens and isn't as easily to move, and therefore people need to go to like bifocals. But that has to do with, again, the mechanics of the lens being harder to move, not that the muscles themselves stop working. So it's a different problem for an adult than it is for a child. Adults will complain their eyes are too short and try to move things far away. Kids will often do the opposite. They will try to move things closer, maybe turn their head, look with one eye, so they don't have to use the focusing system with the eye teaming system. They'll get, like I said, close to the page, somewhat for a magnifying effect because it gets a little bigger when you get closer to it as well. They might rock back and forth trying to find a spot that's clearer. Or again, they might say, that's too hard. I'm just going to put my attention on something that's a little bit easier or put it elsewhere. So focusing skills, like I said, if they're not working well, you can get blurry, distorted print. Similar symptoms to what you might see with an eye teaming problem, but maybe not necessarily a double vision part, but just that things would be hard to look at. So finally, after you focus your eyes on the page, get the eye teaming system to point in the right place, then what happens is your eyes have to track and move and do it all over again. So another area of difficulty that we often see that it can affect learning and schoolwork and attention are eye movement and tracking skill problems. So there's two types of eye movements that we make. So saccades are being able to move eyes from one point to another accurately, so two stationary objects. And pursuits are being able to follow a moving object. So pursuits are more important, or very important in sports as things are moving around. And saccades, though, are very important for when we're trying to read. So let me show you an example of that. We go to our YouTube video. So here's an example of a good reader and their eye movements. This is an eye movement recording device that we have in our office that measures what the eyes do as the child is reading, or adult for that matter. So as you can see, there's a nice pattern where the eyes are pretty much going left or right. When it gets to the end of the line, it has to go back and do it all over again. That's the example of someone with good saccadic skills, as we say. So here's an example of someone who has more difficulty with saccades. So as you can see, the eyes are not tracking as smoothly with across the words. There's a lot of back and forth movement. I think in a second here, or maybe it already had been, where they kind of jump down to the middle of the next line rather than all the way to the end. Yep, if you just saw that. So it's definitely not as smooth. And so that's someone who's probably having to also reread for information. They're not going to get as good a comprehension because their eyes are not tracking across the page the way that they should. They're going to lose their place a lot more frequently, skip over words, maybe even guess about words that make sense rather than reading the words themselves. So definitely not as efficient. Here's another example to kind of put all three things together, because oftentimes we see this triad of difficulties in the eye teaming, focusing, and the tracking skills, not just one area of difficulty. They often all go together. So for this kiddo, we're going to look and see that first he's just trying to track across. Now what you'll see is his eyes like really have difficulty like around his nose, around the midline. Call that. That's very common in someone that has a trouble with eye teaming skills, because those skills really come into play, like we said, in, you know, around the middle of our body. That's where we hold books, usually not off to the side unless there's a problem that we are trying to compensate for. So now there's an occluder. So you're covering one eye and looking with just one eye. And you can see that there is some difficulty with that. He's kind of blinking a little bit more. It becomes really apparent on this eye. You get a lot harder time with this eye, trying to watch and follow together. You can see the eyes jerking a little bit, so they're not very accurate as well. That's where the eye tracking comes in. So he's working really hard. This is a kid that can do it. I'm guessing he's more of a kid that gets kind of the headaches. This isn't exactly my patient, but he's more likely to get kind of headache, eye strain type symptoms, versus some kids, when it gets hard, aren't going to keep up with it, and they're just going to look away. Their brain just says, that's too much, no thank you, I'm just going to go put my attention somewhere else. So to kind of review some of the physical symptoms we might see with these type of visual skills problems, especially eye teaming, so they may get double and blurred vision, or they may not. Again, it depends on how long they stay with it. Sometimes it's fluctuating vision, so it's not always blurry, but it can go blurry, and then they have to refocus, go blurry, have to refocus. Eye strain, headaches, fatigue. Sometimes they're just really like, they save it all, you know, they get through the end of the day, but they are exhausted at the end of a school day. And that's where, you know, you ask them to do one more thing, and they're just going to go over the edge and have a big battle over homework. Excessive rubbing of the eyes or blinking. Sometimes the print does look like it moves around the page or wiggles. I've even had adults who've experienced that and their whole lives and never knew that that was not the way everybody else saw. And that's the problem with some of these visual things, is that kids don't always know that what they're seeing is not correct, that it shouldn't be that hard. Oftentimes they'll see some postural adjustments, so getting close to the page, covering one eye, or kind of tilting or turning the head to kind of compensate for the eyes not working together. But that's if they, you know, those physical symptoms occur more when they actually stay with it. Oftentimes they'll give up long before you get to that point. And then, or if they do, if you kind of keep pushing them, they'll just get angry, frustrated. It might lead to behavioral problems. What looks like, no, I'm not going to do that. It might be because they physically cannot do that. Oftentimes I'll see kids choose their paragraph. So they might look and see how many words are in a book, and if there's too many words, they're like, nope, I can't do it. Or they might choose a book based on the size of the print and want to go with something a little bit bigger print, or let's say comics that are broken up more versus chapter books. A lot of times we see these problems coming up around, second or third grade when they want to transition into chapter books, but then they're not really able to because the print is too small and their eyes cannot use those eye teaming and focusing skills well enough to see that clear enough. So oftentimes what we see more is avoidance behaviors rather than physical symptoms. Poor attention to near work that can look just like attention deficit disorder. Poor reading fluency, skipping lines, rereading or having poor reading comprehension. The eyes are taking up all the energy that it's really difficult for them to remember what they are actually reading. Like I said, you can get eye strain, fatigues, and headaches, but not always. It depends on how long they stay with it. So if we go back to the academic behavior survey and look, now you can start to understand why a child with a visual skills problem might have difficulty completing assignments at school. They might have difficulty completing homework. They may avoid tasks that require reading or close work, including writing. Poor attention to details or making careless mistakes. They might rush through work. I've seen that a lot, where they rush through because they want to get it done in the shortest amount of time because they don't want to have to keep trying to work their eyes. Appear attentive or easily distracted during reading or close work. And then, again, worrying about your school's performance, certainly for all those reasons, but it's going to be a lot harder when they have these type of visual problems to complete their work efficiently and effectively. One of the things I often ask, well, maybe are they just going to grow out of this? When we look at especially the focusing and the convergence system, that system should be working well about 6 months of age. So it's very unlikely that it's just a matter of just a little more time and growth. Now, they might learn some compensation mechanisms to help them work longer. Like a lot of times postural things, again, will help them work a little bit longer, but overall they're not going to be working as efficiently, so they'll never be able to fully catch up with their peers. And unfortunately, it says also, they don't do the reading, and so therefore they continue to get further and further behind in reading, because you still need to practice reading to get better at it. But having this visual skills obstacle is going to make things a lot more difficult for them. The Convergence and Sufficiency Study is what I'm going to talk about next. So that's the study I talked about at the beginning that looked at convergence and attention deficit disorder and found a definite correlation. So those that were labeled as ADHD were 2 to 3 times more likely to have difficulty with the convergence system than someone who wasn't labeled ADHD. Now, that same study showed that when we treated the convergence problem, there was a significant improvement in the symptoms as measured by the academic behavior survey. How common are these conditions? A lot more common than you think. So generally 1 out of every 4 to 5 children will have difficulty with these type of visual conditions. And that becomes a lot higher in those with special needs, depending on the study that you look at, somewhere between 60 to 80%. So those with her having education problems are definitely more likely to have this type of issue. We are talking about fine motor skills, visual motor skills. So if they have a fine motor coordination issue, they're more likely to have a visual motor coordination issue as well. In general, the convergence and efficiency effects by itself affects about 17% of the population, and that's by far the most common vision disorder that I treat. So who should you see if you suspect a vision and learning problem? So there we talk about, what are the different type of eye practitioners that you can go to. So opticians are just basically the ones that sell the glasses. Ophthalmologists are eye surgeons, and they rarely do near-point testing and functional testing for kids. In fact, they are likely to say that vision and learning have nothing to do with each other. Optometrists are primary care eye doctors, and I myself am an optometrist. We go through 4 years of undergrad, 4 years of optometry school, so that's 8 years. And then in my case, I specialized in developmental optometry, which includes what I was talking about today, specialize in functional vision problems such as IT mean tracking, focusing, also work with patients after brain injury, eye turns, those large eye turns that you can physically see, amblyopia, autism. There's a certification process that you can go through, and that's what I've gone through, and that's why the letter FCOVD after my name. There's only about 8 optometrists in the state that have that board certification. What is vision therapy? So vision therapy is a progressive, individualized program designed to remediate and enhance visual skills and visual information processing difficulties. But that may not help you actually know what it looks like. So we do a lot with 3D pictures that increase the demand on the Convergence system. We do a lot with lenses to make you more aware of how to use your eyes, lenses that stimulate the convergence, lenses that stimulate divergence or lessen the convergence demand. We do a lot with lenses that stimulate the focusing system, lessen the focusing system demand so that you have better flexibility between the two. Eye-hand coordination, tracking skills. There's thousands of different vision therapy activities we do depending on the patient and what their specific problems are. But what separates us from, let's say, occupational therapy is the vision therapy use of lenses. What is the success rate for vision therapy? That came out of that same kind of study. The Convergence and Sufficiency Treatment Trial showed that the success rate was, for only 12 weeks of therapy, was 75%. And that was in patients that only had convergence deficiency. They didn't have tracking issues. They didn't have a focusing issue. More typically, you're going to see all 3 issues, and then you're going to be looking at probably more like 6 to 9 months of therapy. Coming in weekly, usually working with a therapist one-to-one, and then also having some home things to do in between sessions. Typically, the success rate when you have a more comprehensive program than 12 weeks goes up to about 80, sometimes 80 to 90%, I would say. Will my insurance cover? So some insurances do cover. For instance, we're an affiliate provider with Group Health, and depending on how your insurance plan is written, they may cover. A lot of the state and local plans do not have coverage for vision therapy, so it's really plan specific. Blue Cross Blue Shield is another company that often will cover vision therapy. And then the coverage, though, it can be based on the diagnosis. So we often will send in a pre-authorization letter before treatment begins to determine the level of coverage. Sometimes we know what plans usually don't cover, and that might have to just skip that step because we pretty much know they're not going to cover. There are also payment plans available that we offer if there is no coverage through Care Credit. Our office tends to be, except for Group Health, with a pre-authorization letter, tends to be a fee at the time of service. How else can you help? So some of the things that we look at is the print size. So finding the right and most comfortable print size, usually it's somewhere between 14 to 18 point font. More importantly, I think, is to decrease the amount of visual information on the page. So I often use a white card to kind of block out some of the information, make it easier to track. I do that with math as well. So a lot of times you'll get those 100 problem pages for time tests. That can be pretty overwhelming, and the child may not do very well on those because there's too much on the page. So trying to block out information is really will help them be a lot more successful. Less likely to make mistakes as well. Modifying written work. So sometimes I use a whiteboard or a little bit bigger, bolder print marker versus a pencil to see things. And of course, allow for movement breaks. So it's really important that these kids get their recess break so that they're outside moving and not having to focus and use their eyes. It's where we sometimes look at, what other activities are they doing. A lot of kids will maintain their attention pretty well for a screen, but it may be exacerbating some of their visual problems. So we try to limit that to, depending on the type of screen, 15 minutes to an hour a day. And then I often use a slant board or at least tilt the book up. So if you have the book flat on the desk, it's going to be a lot harder to look at. If you think about it, we naturally will tilt the book up to about a 20-degree angle when we're looking at things. You can also do that for writing using a binder, or there are special slant boards that you can buy and that we sell in the office that help put things at the right angle to make it easier. Some other considerations to look at is when there's a big hyperactive component. Some kids I see definitely have more than just visual problems going on. Sometimes there's some spatial and body awareness issues. Sometimes they need to work with an OT as well to work on integrating sensory information. So a combined approach is sometimes needed when you get more severe cases of attention, and especially that hyperactive component. And then diet. Sleep and allergies can, poor sleep, allergies can contribute to difficulties with attention. So that's the information presented today. I appreciate everybody for signing up for the webinar, and please feel free to contact us. There's our website. You can also check out our Facebook page. We also have a monthly newsletter that we e-newsletter that we send out. You might also check out covd.org or optometrist.org for more information about the things that I discussed. And then the Facebook support group called Vision Therapy Parents Unite has a lot of parents who are in similar situations, have tried different things that can provide you some help and some guidance if you wanted to sign up for like their page. They often have very good information there. You can contact us. I have our email down there, or I guess I didn't put the phone number on there. It's 608-849-4040. Thank you.